Welcome back, everybody. So June is Cataract Awareness Month, and the Caribbean Vitreous and Retina Surgery Limited and Trinidad Eye Hospital want to share with us the significant impact that surgeries can have on individuals and the country at large. With us is CEO and Consultant Ophthalmologist, Dr. Ronnie Bhola. Doctor, good morning.
Hi, good morning. Good morning to all the viewers, and thank you for having me on the program.
Yes, well, it's good to have you, Doctor. Doctor, what can we expect for Cataract Awareness Month? What's the focus?
The focus is to really make people aware of two groups. One is for the population. If you're noticing changes in your vision, get your eyes looked at. It could be cataracts. If it is cataracts, you're kind of lucky in a way, because it is a condition that most people cannot avoid in their lifetime. Most people will get some amount of cataracts, but it's one of the conditions that is reversible, and the vision improvement could be phenomenal. So don't be worried if you reduce your vision going down a little bit and you're told that you have cataract. The other thing we want to do in this month of June is to let the decision makers who really can get people their surgeries, we want to get them to understand the economic impact that cataract surgery can have on a country, and also the human issue that cataract has on people's lives and their families, and really they need to take action.
Doctor, who is most susceptible to this?
So 99% of cataracts is due to aging. There are some other causes of cataracts, things like trauma, diabetics, some eye conditions, but really aging is the main factor in the development of cataract. We also think that sunlight plays a role. So in the Caribbean, we may have a higher rate of cataract development than in colder climates. But all in all, aging is still the most common predisposing factor. And therefore, once you cross 60, you'll have a little bit, it may not be visually impairing the vision at that age, but later on, maybe in your 70s or 80s, it will start to give you some reduction in vision. And it depends on your lifestyle too. If you're a very active person, you drive a lot, you do a lot of work on the computers, because nowadays people are working way up into their older years. So you may still be very active and need really, really crisp 20/20 vision. And that is possible with cataract surgery.
What are the symptoms?
Most people will complain of problems with doing their daily activities. Like if you're driving, you find driving becomes a little difficult. Some people get other symptoms like glare, like especially at night. They get when the bright lights hit them, they feel blinded by the light, or they look at a street light and it all of a sudden has a streak on the light, and some of them get photophobia with it. But by and large, it starts to affect your clarity of central vision.
Yeah. If you had to describe it to us, Doctor, how would you describe what cataract is?
A cataract is when the lens in the eye, which usually allows 100% of the light to come in the eye and get to the back of the eye, gets cloudy. So it's a clouding of your natural lens. And what happens is the light now is blocked from getting to the back of the eye. And when that starts to reach about 20% reduction in the amount of light, you start to notice things don't look as clear as they used to look. And then it slowly over time gets worse and worse.
Yeah. And how is this cataract removed?
Right, and that is the beauty of technology. So with the advancement of cataract surgery over the last 50 years, remember cataract before that, 50 years ago, we couldn't really do a lot to improve your vision to the level at which we could do it now. Because cataract surgery has advanced, what we do in cataract surgery is really simple. It's a 10 to 15 minute surgery most of the time, painless. Because it's so quick, it's efficient, and your vision recovery is usually very rapid. Within a day or two, you'll notice you go from not seeing to really good vision. And what we do in the surgery is we don't use the sutures anymore. It's very rare now to have to do that unless the cataracts are really, really hard. But most of the times we use a technique called phacoemulsification, where we just break up the lens into small bits and suck it out through really, really tiny incisions. And that allows us to do sutureless surgery, painless surgery, and we remove the lens from the lens sac that it sits in, take the white stuff out, which is the cataract gone cloudy, and we replace that with an artificial lens. And that artificial lens now allows 100% of the light to get in the eye, and the lens allows us to determine the focusing power now of the eye. So we could vary now the outcomes of surgery depending on the lens that we choose.
But doctor, here's the million-dollar question now. How much does it cost?
So cataract surgery really varies in cost in private practice, from around about $9,000, $10,000 to up to about $14,000, $15,000 for your standard type of cataract surgery. But there's a lot of, some variations here and there.
Is that per eye or both eyes?
On the scenario.
Is that's per eye?
That's per eye. But that's per eye or per surgical intervention. And we usually do one eye at a time. We hardly ever do two eyes. There's a lot of debate now whether we should be doing two eyes at the same sitting, but because of the minuscule risk involved in any surgical procedure, we always tend to go cautiously and do one eye at a time. We do one eye, make sure everything's going well, and then we do the other eye.
Doctor, how often should we be testing our eyes?
Once your eye is healthy, determined by your healthcare practitioner, it might be an optometrist, might be your doctor, might be screening team that go out and look at eyes. Once we determine that the eyes are healthy, then every 1 to 2 years is enough for you to have your eyes looked at or checked. And that is if you're doing well. But if you're starting to notice problems with your vision, obviously you should get checked a bit earlier than the recommended 1 to 2 year period.
Doctor, do we have a serious situation of persons with cataracts in Trinidad and Tobago?
I'm afraid so. We have something called a cataract surgical rate that is really given to us by institutions that look at countries and determine how many cataracts we should really be doing to make our country a country that is not blinded by avoidable conditions like cataract. And we are supposed to be doing in Trinidad around about 6,000 cataract surgeries a year to really have a good rate to say that we are a developing or developed country. We are really operating in Trinidad in cataract surgery like an underdeveloped country with a lot of blindness due to a needless, avoidable blinding condition. Or cataract surgery, we should not be having this problem at all in a country like Trinidad, which is close to they call it developed, but we really operating as if we are underdeveloped in terms of cataract surgery. And the reason is, and I want to bring this out, the economic impact of cataract surgery on a country is great. It is our role as eye care professionals to really analyze data, to use all our experiences to help government to make better decisions with their healthcare budget. And that's one of our roles. And what we should be really impressing on the government and on people in leadership positions that make decisions on how to spend their healthcare budget. That cataract surgery is a great way to spend your money because it is well researched in the US and the UK and other countries, and they know that the economic impact on a country of relieving blindness due to cataract. Cataract surgery doesn't only have immense economic benefits. It also improves the quality of life of the patients who get the surgery. It relieves the burden of care on the families that have to take care of these people who are not seeing well. It improves your workforce. And when they do all the research on cataracts for economic benefit, it is 5,000 times the cost you're going to spend on doing the surgery for the economic benefit. It's great, and it's considered one of the best medical interventions ever developed within the last 100 years. So this is a no-brainer for our government. They should be spending on getting their people seeing in their older years.
Yeah. Doctor, anything else you'd like to touch on before you leave us this morning?
I think if you notice you're having difficulty with your vision, you're noticing glare, anything like that, you really need to see your eye care provider and let them have a look to see if you have cataracts or if there's anything else going on in the eye that causes you problems. And I want to impress on the leaders that we need to take action on cataract. It's a needless, avoidable blinding condition, and we need to get serious.
Dr. Ronnie Bhola, thank you very much for speaking with us this morning, sir.
Thank you. Thank you for having me. It was a real pleasure.
Thank you. Thank you very much again.